Hi, my name is Dr. Kerry Tapuzian, and you're watching the Ask Dr. T show. Today's question is, how do you treat an acute traumatic injury? So let's use an example of what I did to myself a couple months ago. I got hit with a puck, slap shot, to my forearm, to my wrist. It's a stupid thing. Arm instantly went numb. Thought I broke it, but I didn't. So after the game, I put ice on it, wrapped it up, used laser treatments on it for about once a week. And I was really being kind of lazy. I really wasn't taking care of it as well as I should. I was doing some mud packs on it as well. But after about, 2, 3 weeks, it wasn't getting better. My hand, the whole right side of my hand was numb. I still had this huge bruise and a lump on my forearm. So I said, okay, this is ridiculous. This is going on too long. I started using laser treatments on the location where I got hit, 20-minute sessions every day. And within a week, 50% of it was gone. So I'm like, okay, Kerry, why didn't you do this initially? And I was, again, just being lazy. So, and then I kept doing it. And then within 2 weeks, it was like 90% gone. And right now it's almost 100% better. So why? How do lasers work? What's the mechanism of action? Well, it's really interesting because lasers, they also call it photobiomodulation, which is very similar to what plants do with sunlight. So plants are able to absorb sunlight. Plants are able to absorb sunlight and create energy. So believe it or not, your body can do the same thing. Your body has mitochondria in each cell in the body. The mitochondria can absorb the light energy from the laser in the form of photons, creates energy, and then those cells start functioning at maximum performance. Okay? So it's really important when you're looking at a laser that you have to know how strong it is, which is wattage, and what wavelengths that you're using. The laser we have, it has 3 different wavelengths and it puts out 45 watts. Okay, it's pretty strong, and it'll penetrate anywhere from 7 to 9 centimeters in depth. So then there's 4 other properties that these lasers have besides, instilling photons, creating energy, is they decrease inflammation to the area that you're treating. It also, the third thing it does is it increases circulation, so you get better blood flow, more oxygen, and you're also able to detoxify that area a lot better. The fourth thing that it does is it increases local growth factors. So it's almost like doing a stem cell injection or a PRP injection into the area, because the growth factors increase, which improve healing to the area. And the last thing that lasers do is they increase local melatonin production. So it's like, okay, how is that beneficial? So is it going to put that part of my body to sleep? No. Melatonin is one of your body's main antioxidants. So then your mitochondria, your cells are able to use this antioxidant to decrease oxidative stress, which is basically like rusting, internal rusting or inflammation. So it's able to kind of like decrease the aging of that cell. So 5 things that laser treatments will do. Usually we recommend for acute injuries 6 to 12 treatments lasting 20 minutes each. Sometimes you need to do more. If it's a chronic injury, you usually have a tendency to have more treatments because it takes longer to get all that inflammation out of that area of your body. If you have any other questions, you can check out our website at askdrt.weebly.com. I'll put some of this information and links in the bottom here. If you also have any questions, you can email us at drthelpdesk@gmail.com. My name is Dr. Kerry Tapuzian, and you've been watching the Ask Dr. T show. Take care of yourself.